I think also too is like prior to menopause, you don't need hormones. So perimenopausal patients, that's a myth,
Yeah.
right? Where perimenopausal women just are left off of the whole equation.
Right. Or women that have, at a young age, have had, their ovaries in tubes taken out. So it's kind of a surgical menopause.
Oh yeah.
So there's that whole population as well that exists out there.
I have a lot of those
Yeah.
patients.
Two weeks ago, I had a patient come in, had a surgical hysterectomy and young, 32 years old, no hormones.
No hormones.
Yeah,
Exactly.
symptomatic.
So,
like,
so, and
what?
so the problem with that is like, just talking about the balance, like we're talking about the different types of estrogen. There's like three different types of estrogens in the body. The E1, E2, E3. E2 is the most dominant one that comes from from the ovaries. But so when you have a surgical hysterectomy at a young age, the dominant protective, cardioprotective, good, healthy estrogen is now at a lower level. And so how that could be overlooked is, I mean, it's just, I guess this goes to the lack of education and understanding of the providers in terms of how this all comes together and works, which, like, if you're going to take the ovaries and everything out, you should think about this as well.
Especially at such a young age.
Yeah,
right?
especially at a young age.
I mean,
Because that's 20 more years of risk exposure.